My name is Kate Birch, and this will be my second video. For my first skill, I will be performing oral hygiene on an unconscious patient. So the first thing I'm going to do is verify that this is my patient. So I would use a name badge or medical record since he cannot speak. Hi Clarence, my name's Kate. I'm going to be performing oral care today, okay? Alright Clarence, I'm going to raise you up to comfortable working height, which this is the height as it will go. I'm going to raise your head up, okay Clarence? And I'm going to raise the head of the bed to prevent any aspirations. Okay, at this time I'm going to test my suction that's in the room, make sure it works. I have all my materials gathered, I have everything done and out of my way, so nothing will pull me from this skill. Okay, and then the next thing I'm going to do is I'm going to lower the handrail. Perform proper hand hygiene. And put on gloves. Okay, so the first thing I'm going to do is I'm going to test respirations for a minute to make sure I have to have lung sounds to compare to make sure he hasn't aspirated at the end of the procedure. So I would use my stethoscope and listen to lung sounds for a minute, watching chest rise and fall. And lung sounds are normal, I'm going to say they're 18. Then I'm going to stick a towel right here to keep my patient dry. Then I'm going to use my assistant and we're going to, this is my assistant, I'm going to have her in the room. Next, I'm going to check the inside of the mouth using a tongue depressor. I'm going to check for a gag reflex or any abnormalities or abrasions that I need to be aware of in the mouth. There's no gag reflex present, and at this time, my partner and I are going to roll the patient toward me. Thank you. Okay, you've got it? So at this time, I'm going to clean my patient's mouth using a little bit of liquid. I'd use as many of these as I need. I'm going to clean the inside of the lip, the buccal, I'm going to clean the tongue, tops of the teeth, bottom sides, and every time these get dirty, I'm going to replace it. Okay, the mouth looks good and clean. So now we're going to roll the patient back. And thank you. At this time, I would assess lung sounds again to make sure nothing was aspirated. And that's how I perform cares for a unconscious patient. When I'm done, I chart everything, I take off my gloves, I perform proper hand hygiene. The next skill I'm going to perform is cleaning dentures of a conscious patient. So the first thing I'm going to do is, since I already know this is my patient, this is the same patient, is I'm going to perform proper hand hygiene. My patient is already in a comfortable placement. I'm going to put on gloves. I'm going to ask my patient if they have any sores or cuts in the mouth, anything that's bothering them. Clarence says everything feels good. So I'm going to remove the dentures using pressure. I'm going to pull down and just kind of break that section. I've got the top denture, I'm going to put it in a basin of water. I've got the bottom denture, pull, break that section, put it in a basin of water. I'm going to let them soak and let them clean it. After a little bit, I'll take a brand new clean toothbrush. I'm going to gently brush the teeth, the insides, and this, because sometimes there's food particles, there's glue. Okay, then I would rinse them and put them in a new clean container. And then I do the same with the other, this is the lower denture. Brush it, very nice. Rinse it and put it in a clean container. Next, I would take my adhesive and I'd put 3 small dots inside, and I would replace that denture. And I would take the upper denture, 3 small dots, and I would help the patient. I would educate the patient on denture care importance, I would ask the patient if everything feels comfortable, if they feel clean, and I then would document everything. I would take off my gloves and perform hand hygiene again. And that is how I would do denture care for a conscious patient. All right, the last skill I'm going to perform today is a bed bath and change the bed. So the first thing I'm going to do is I'm going to get all of my materials. Since I'm leaving, these go up, bed goes down. Okay, since I'm leaving, I would put the bed as low as it would go. I would get one basin full of clean water, more than enough towels, and a gallon. All right, now I'm going to perform a bed bath. So the first thing I would do is I would raise the bed to become full working height. I would raise the bed. I'd perform proper hand hygiene and put on clean gloves. Hi Clarence, how are you? Oh, I'm glad you're having a good day. Do you have any cultural preferences or allergies or sensitivities to any soap that I need to know about? Nope, pretty easy going. Okay, that's good. All right, Clarence. I'm going to get you ready for a bed bath. So I'm going to use my partner, and we're going to, first I'm going to remove this pillow and put a towel underneath his head. Take that, thank you. Okay, so keeping the patient private, we're going to remove the gown. Hold on. I'm going to put a bath towel on top of him first. Will you help me unfold this? So we're going to keep the patient private and be respectful of the patient. Okay, now we're going to remove, thank you. We're going to remove your gown, sir. And we're just going to roll it down. Next, we're going to roll the sheet down. Okay. And then my assistant would get these sheets, rolling them away from us, and we'll dispose of them in a proper laundry hamper. All right, so Mr. Clarence, would you like any soap on your face? No? Okay. So first, I'm gonna replace my gloves and perform proper hand hygiene. Okay, so now I have fresh, clean gloves on and clean hands again. Using a towel, a small one, and only water, I'm going to fold it and make it into a mitt. All right, I'm gonna clean the eyes from the outside inside out, and then fold this over using a fresh portion inside out, and then using a new